All right, November is National Diabetes Month, and treatment and lifestyle changes can lead to a healthier life, and that's why we brought in dietitian Stacey Conover, who joins us now with more. What got you started on the diabetes kick?
You know, I work in kidney disease, and diabetes is the leading cause for kidney disease.
First signs of diabetes.
First signs are going to be frequent urination. People tend to be really thirsty and unexplained weight loss.
I always thought the thirstiness, that was the number one factor, right?
But they lose weight too, and nobody loses weight by accident.
Is it a diet? Is it hereditary? What is it?
It can be a lot of different things. I mean, there is some hereditary connection to it, but obesity plays a role in it, so there's a lot of different things.
Tell me how the kidney is connected with all of this.
Kidney disease, diabetes is one of the leading causes of kidney disease. 1 in 3 people with diabetes have kidney disease, and unfortunately some people don't even know it. When the kidneys are affected with high blood sugar, so when somebody has diabetes, their blood sugar is consistently elevated because their insulin's not working properly, and that has, the blood is flowing through the small vessels to the kidney, and that can create the kidney damage.
Explain the types. You got the type 1, type 2 diabetes.
Type 1, you're not making insulin. Your pancreas isn't creating it. So your blood sugar is incredibly high, so you have to take insulin to lower the blood sugar. Type 2, sometimes they're insulin resistant, so the insulin, you might be creating some, maybe not enough, and maybe the insulin's not picking up the blood sugar the way it should, so it's not working the way it should.
Once you have diabetes, do you have it for the rest of your life?
It can go into remission. I'm not an expert on diabetes. I know some people who, they took care of themselves, they made lifestyle changes, they lost weight, and it became under control and they went off of medication. So there are a lot of things you can do, but you are at an advanced risk.
All right, you're the dietitian. Tell us how to avoid diabetes. What should we be doing right now?
Well, there's a lot of different things. Again, I work in kidney disease. I work for Educator.com. Being educated is incredibly important. So when you're going out and you're looking for information, look at the risk factors. You make sure that you're taking care of your diet, make sure that you're going to the doctor. You want to make sure that you're learning what your lab values are, and DaVita is great for that. We have www.davita.com where you can have a ton of educational information on diabetes, on taking care of yourself.
Tell us about the dialysis finder. A lot of people have to go to dialysis because of the kidney.
Exactly. So, like I said, 1 in 3 people with diabetes have kidney disease. 1 in 10 Americans have kidney disease. It's incredibly common.
How many don't know?
A lot.
Really?
A lot. There aren't really a lot of symptoms until it gets pretty far gone. And we have 550,000 people in the U.S. who have end-stage renal disease. So CKD, or chronic kidney disease, has 5 stages. So it's a long-term condition. People get to stage 5, that's considered end-stage. We have 450,000 people on dialysis. So we're still 100,000 people that aren't on it yet, but are going to be.
Man, how frustrating is this for the people that have it?
Well, the thing is, when you're being proactive about educating yourself, you can go on and look for Dialysis Finder, or CMS, or the Centers for Medicare and Medicaid Services have created a 5-star rating scale. This is really important because every dialysis facility in the country is looked at for patient outcomes. So they're looking at the clinical outcomes for each facility, putting it into a database, and it creates a bell curve. So they rate every center on a 1 to 5-star scale. So you can look up the centers in your area and find a 5-star or 4-star. Every single clinic is held to government standards, though. So you're never going to go to a 1-star clinic and it's going to be terrible. But you do want to try and find the best one you can. They all have to meet the standards, though.
Stacey, thanks for bringing awareness.
Thanks for having me.
National Diabetes Month. You turned somebody's life around tonight.